And the fourth and final thing that we must do to build a foundation of health for our children is perhaps one that you wouldn't expect me to say, but I believe it's perhaps the most important, which is that we must cultivate the ability of children to give and to receive kindness. Kindness is not just a virtue. It's not just a value, but it's actually a source of healing. This isn't something I learned in medical school. I wasn't tested on it on the boards. But it is something that I learned by caring for patients, something I understood by seeing the growing literature on the impact of meaning and happiness on health, something I came to understand and believe by listening to the countless stories of children and adults that I encountered in the United States and abroad. Now, too often our culture, our media, and our politics teach us that expressions of kindness, whether they be compassion, generosity, or forgiveness, are signs of weakness. But there's nothing weak about kindness. Some of the most successful people in our nation's history trace the origins of their strength and success to the kindness of a parent, a teacher, or a close friend. The kindness of Mother Teresa moved governments, moved institutions, and inspired millions of people. And it was the kindness of boat captains on the Hudson River in New York who ferried nearly 500,000 people to safety on 9/11. And it was that kindness that inspired millions of Americans during one of our darkest hours. Kindness, it turns out, may very well be one of our greatest sources of strength. So the question for us is, can we help our kids see kindness as a source of strength and not a weakness? Can we help create a culture of kindness in our families, in our communities, and in our institutions? And can we be role models for kindness in how we treat others, especially those who may differ from us in background or viewpoints?